Hello. This is Dr. Eunice. I'm coming back to talk about two um, disorders. One is in DSM-5 and the other one is not. PTSD is found in DSM-5. So PTSD stands for post-traumatic stress disorder and complex PTSD. So I will compare and contrast these two. I know there have been a lot of debates on whether complex PTSD needs to be added into DSM 5. And so you're going to decide this for yourself. So let's go. So for the distinct characteristics of PTSD is this has to be an event, single event. It occurs in response to a single traumatic event or series of traumatic events. Symptoms include experiencing the traumatic events, avoidance of trauma-related stimuli, or something that maybe look like it's going to remind you about what happened in the traumatic event. Of course, there's going to be negative alterations in mood and cognition, as well as being hypervigilant and hyperarousal. So trauma is typically discrete and identifiable. So it's a car accident or, a tornado that happened and caused the PTSD. So diagnoses are based on DSM-5 criteria for PTSD, and the treatment involves evidence-based therapies, of course, such as CBT, cognitive behavioral therapy, and also EMDR, also known as eye movement desensitization and reprocessing, and of course, medication such as SSRIs. So individuals that have PTSD may experience significant impairment in daily functioning and relationships as a result of PTSD. So it does affect how your client or patient is going to present themselves when they come to your office. So remember, I do not give diagnosis. I am not licensed to give diagnosis. I'm in that process of getting licensed, but so this is just for educational purposes. So let me compare PTSD and complex PTSD. So for the complex PTSD, it is occurs in response to chronic repeated trauma, often interpersonal in nature, such as childhood abuse, neglect, domestic violence. So these are things that are continuing to happen. They are repeated in somebody's life, especially early childhood. In addition to symptoms for PTSD, individuals with complex PTSD are going to experience difficulties in emotion regulation, self-concept, and as well as interpersonal relationships. So trauma may be ongoing or occur over an extended period, leading to complex and pervasive psychological effects. No, not currently recognized as distinct diagnosis in DSM-5. As I said, there has been a lot of debate on that, but it is acknowledged in the ICD-11 International Classification of Diseases 11th revision, which is by WHO. Treatment may require a more comprehensive and prolonged approach addressing the complex interplay of trauma-related symptoms and their impact on various aspects of functioning for the individual. So therapeutic modalities may include trauma-focused therapy, dialectical behavior therapy, DTB, and psychodynamic therapy. So individuals with complex PTSD may face additional challenges in regulating emotions, forming healthy attachments and maintaining stable relationships, leading to more pervasive and definitely enduring difficulties in functioning. You can use CBT, you can use EMDR to treat PTSD, and I think obviously because it's complex, we require a lot of experience in doing that. So understanding the distinctions between the PTSD and complex PTSD is very, very important for mental health professionals. As I said, PTSD is in DSM-5, but complex PTSD is not in there, which is obviously something that, a lot of people have been debating about it, because some people experience a car accident, or they might go to war, which is more than, the event is occurring over and over. You might have children that have been in a domestic violence home, or they might be sexually abused by an individual perpetrator throughout their childhood. Even when they grow up and they are youth, definitely that really complicates the trauma, because it's ongoing and it is repeated. So obviously, as I said, for treatment for complex PTSD is going to be similar, except that the complex interpersonal and emotional dysregulation aspects will need to be considered in complex PTSD. So I hope that I helped you grasp this concept. So for the complex PTSD, is really, you can really say it's a concept. It's not really a diagnosis in PTSD. I have to clarify that. So my videos are not for diagnosing. They are not diagnostic procedure in any ways. They're just for you to use when you're doing your exam, to remember this, just in case you're using DSM-5. You don't have to worry about the differences. But I just wanted to throw that in there as we're talking about these disorders. So thank you very much for listening. Like my video, subscribe, share with someone that might need to know this information. And I love that you come to listen to me.